I'm just going to say welcome again to the inaugural session of the Global Health Politics Workshop. This is generously supported through a grant from the Party Center for the Study of the Longer Range Future. I want to thank Dean Scott Taylor of the Party School and Party Center staff, most notably John Prandotto, for their help in making this workshop possible. We're glad that you are here, whether in person or virtually. Today, we'll be hearing a talk by Carmen Ho on Does Democracy Reduce Health Inequalities? Evidence from Africa. And as I mentioned earlier, due to a turn of fate, our talk today will be virtual. Carmen will be joining us from Guelph rather than in person, but we're nonetheless excited to hear her fascinating and important research. I'll just call attention again. We have other talks this semester, 3 in fact, and the next is by Jalicia Jolly on October 17th. At the same time, please come as you're inspired either in person or virtually. But now I'll turn our attention to our speaker. So it is with great pleasure, and I'm deeply honored to introduce Carmen Jacqueline Ho. She is an assistant professor in the Department of Political Science and also faculty affiliate with the Institute of Development Studies and One Health Institute at the University of Guelph in Canada. She's a member of Harvard University's Research Cluster on Comparative Inequality and Inclusion at the Weatherhead Center for International Affairs, and she's held a Fulbright at the Harvard T.H. Chan School of Public Health in the Takemi Program in International Health there. Her research and teaching interests are intertwined in comparative politics and public policy with a focus on health politics and policy. And her work very recently has hit it big with publications at the #1 Public Health and Medicine journal and the #1 Political Science journal, the American Political Science Review and the Lancet. Carmen, thanks so much for joining us.
Thank you so much for the opportunity to join the Global Health Politics Workshop. It really is an honor to be here. And, thank you to Joe for leading this, for organizing this, and for providing this really amazing platform for all of us to come together. So what I'm going to be doing is talking a little bit about a paper that Christelle, Roland, and I have been working on. And it's centered around this question of, does democracy reduce health inequalities? Now, we often think about health as a product of individual behavior. So we're very used to hearing recommendations about, how we stay healthy by being fit and exercising, or by eating nutritious foods or abstaining from smoking, for example. And these are all very important individual behaviors. But our health is also a product of broader structural factors, the conditions in which we're born and the conditions in which we grow. And there are many different structural factors that affect our lives and our health. But in today's talk, I really want to focus on the political system in which we live. Now, conventional wisdom suggests that people living under democratic regimes have better health outcomes in comparison to those who live under authoritarian regimes. So if you and I lived in a democracy, for example, chances are we'd be more likely to survive past infancy. But, how do we know this? Well, one way of figuring out if democracy improves health outcomes is to look at a lot of countries and to see if democratic regimes are actually associated with lower rates of infant mortality. And so there's an extensive body of large and quantitative research that shows, on the whole, democratic forms of governments do produce better welfare outcomes. And this field has actually grown rapidly, and it includes important qualitative studies which also show the different ways in which democracy can work to achieve better population health. But what we know less about is how these health outcomes are distributed across the broader population. So we know that democracy is reducing infant mortality on average because there's a lot of large N studies that show this, and this is complemented by really important qualitative work. But democracy's benefits could be accruing to advantaged groups in society, leaving disadvantaged groups behind. And this would be masked if we were only to look at democracy's average impact on population health. So there is a research question that I've been alluding to, and you may have picked up on this. And that research question is, does democracy reduce health inequalities? And this is the research question that Christelle, Roland, and I focus on in our paper. And what we're looking at is how democracy affects the rates of infant mortality of a disadvantaged group relative to an advantaged group. Now, we call a disadvantaged group one with limited resources. So resources include things like income, like wealth, physical capabilities, and other advantages. So a disadvantaged group is resource constrained, and an advantaged group can be thought of as resource rich. And what I'm going to do is I'm going to use these terms disadvantaged and resource constrained and advantaged and resource rich interchangeably. But the basic idea that I'm trying to get at is if democracy improves outcomes of a resource or health outcomes of a resource constrained group relative to a resource rich group, then we can say that democracy has reduced inequality, because what it's doing is it's reducing the gap between these two groups. Now, what I'm going to do is I'm going to give away the answer to the research question, and I'm going to let you know that our core findings are that democracy reduces health inequalities. So let me tell you a little bit about how we came to this conclusion in the paper. Now, the WHO says that any serious effort to reduce health inequities being avoidable health inequalities between groups of people. So any serious effort to reduce health inequities will involve changing the distribution of power within society to the benefit of disadvantaged groups. So what we do in our paper is we develop a theoretical framework to explain why democracy is expected to change this distribution of power in society and subsequently reduce inequality. And based on the existing literature, what we know is that democracy is supposed to work along two tracks. The first track being electoral competition, and the second track being civil liberties. And it's supposed to work in a particular way in that it shifts the power to disadvantaged groups. So let me start by talking a little bit about electoral competition. The idea is that democracy gives the broader population the right to vote in free and fair elections. And this then creates incentives for governments to serve disadvantaged groups. So, I mean, if you think about it, we know that politicians are concerned with staying in office. And so if disadvantaged groups now have the right to vote, then politicians have incentives to provide public goods and services to meet their needs, because politicians want to garner this electoral support. So public goods and services are expected to improve. And this then should also improve the health outcomes of disadvantaged groups. So this is one track by which democracy ought to reduce health inequalities. Now, democracy also expands the freedom of association and the freedom of speech, both of which fall under this broad category of civil liberties. And civil liberties give disadvantaged groups new opportunities to organize, to mobilize, to demand governments meet their needs. So disadvantaged groups can now organize protests and marches. They can circulate petitions, critique the government in newspapers and other media platforms, and so on. And so in this way, the expansion of civil liberties increases the pressure that disadvantaged groups can place on governments to meet their needs. So again, what we would expect to see here is better public goods and services because of this expansion of civil liberties. And we would subsequently expect to see better health outcomes for disadvantaged groups. But we know that democracy does not always work perfectly. And actually in our breakout room, we were just talking about Indonesia's rollout of universal healthcare and how that hasn't necessarily been working perfectly. But we see headlines like this all of the time. So many across the globe are dissatisfied with how democracy is working. And there are also headlines that ask, is democracy good for everyone? And intuitively, we know that democracy isn't working exactly as promised because democracies around the world can coexist with inequality. So what our paper does is it introduces the concept of dual track capture. And we try to show that democracy can be captured along the two tracks that I just described. What I mean by this is that resource-rich groups can capture democratic institutions so that they don't always work to serve disadvantaged groups. And so because of this, we may not necessarily see these expected reductions in inequality. So let me talk a little bit more about the capture of electoral competition first. So as I had said earlier, in theory, competitive elections provide disadvantaged groups with the power of the vote and this ability to elect politicians who meet their needs once they get into office. But in practice, what we see is that politicians have relied on clientelism and not the delivery of goods and services to gain political support. And by clientelism, what I mean is that politicians are offering citizens material favors in return for votes. So politicians have stayed in power by strategically buying votes rather than by actually providing these essential goods and services. We've also seen other examples where politicians have hired brokers, for example, to drum up political support. And it's been brokers' effectiveness and not actually politicians' performance that has proven pivotal for campaign success. And we've also seen politicians who allocate public projects to their supporters or folks whose votes they're looking to buy, rather than allocating public projects to those who would benefit the most. And those who would benefit the most tend to be resource-constrained groups or disadvantaged groups. So this is really just to say that, electoral competition can exist, but it can also be captured. And as a result, democracy may not actually be changing this distribution of power in society. And because of this, we may not be seeing the anticipated reductions in health inequalities. Now, let me talk a little bit about civil liberties, because in theory, civil liberties are supposed to give resource-constrained groups the ability to organize, to mobilize, to exert power. But in actuality, this really isn't as straightforward as it sounds. So for disadvantaged groups, it can be difficult to secure the basics. The next meal, emergency medicines, affordable housing. And under these conditions, it may simply be that disadvantaged groups have limited time and energy to exercise their civil liberties and demand that governments do more for them. So in other contexts, what we've seen is that resource-constrained groups, such as the poor, are not any more supportive of government redistribution than the non-poor. And this is in part because there's been a history of under-provision of basic goods and services. So what studies or this study has found is that the poor have diminished expectations. They don't expect to benefit, so they don't organize and mobilize to demand more. And even when disadvantaged groups have been able to overcome these barriers and effectively express their preferences, what we've also seen is governments flat out ignore citizen demands. So if we go back to this WHO quote, the WHO says that any serious effort to reduce health inequities will involve changing the distribution of power within society to the benefit of disadvantaged groups. Well, our concept of dual track capture shows that democracy may not actually change these underlying power dynamics, and resource-rich groups can continue to capture government institutions. So we may not be seeing democracy reducing health inequalities. So this is why we need to look a little bit more closely at democracy's impact on inequality. And that is why our research paper asks, does democracy reduce health inequalities? And now this is a really important research question, I think. But one of the major challenges that large N studies face when trying to answer a question like this is the endogeneity problem. So some of you may be familiar with this, but I'm just going to talk quickly about two components of the endogeneity problem. And the first issue is that of reverse causality. And basically the idea is that democracy might have an impact on inequality, but causation can also run in the opposite direction. So let's say we're trying to look at the impact of democracy on economic inequality, for example, and we're trying to build a model to figure out if democracy reduces economic inequality. The challenge is that existing research tells us that economic inequality can also influence democratization. So what we see here is like a circular effect. It's a circular effect between the independent variable, democracy, and the dependent variable, inequality. And what this circular effect does is it undermines our ability to know what is causing what when we're building our model. So I'm going to give you another example. We could be interested in whether democracy reduces gender inequality. And democracy could do this by improving the status of women relative to men. But research has also shown that lower levels of gender inequality are thought to cause democracy. So again, what we see is this circular relationship undermining our ability to know, what is causing what. And this would then lead to inaccurate results if we were to run the numbers and there was going to be this issue of reverse causality. So what we're trying to do in our paper is we're trying to find a relationship between democracy and inequality where we're pretty confident that the causation running from democracy to reductions in inequality is a one-way relationship. And this would then rule out the possibility of reverse causation. And so to rule out the possibility of reverse causation, what we do in our paper is we develop a quasi-natural experiment that uses twins and singletons as proxies for resource-constrained and resource-rich groups. So let me just explain why we're doing this. So twin births are associated with a range of obstetric complications. So they're associated with low birth weight, and low birth weight is linked to a reduced odds of survival, a higher risk of health issues. Twin births are also less likely to be viable, so there's a higher risk involved. So what we can think of twins as is resource constrained. And actually, even after they're born, parental resources are split over 2 infants instead of 1. So this resource constrained piece persists into the first year of life. So if we have twins and singletons who are born in the same household, we could look at how twins fared relative to singletons under different political regimes. And then what that would let us do is compare a resource-constrained group to a resource-rich group. Now, the methodological innovation here is that democracy can influence the rates of infant mortality in twins compared to singletons. And this would help us kind of get at this question of whether democracy is reducing inequality. But the level of inequality between twins and singletons is unlikely to affect democracy. So what we have here is this one-way relationship that we've been looking for. And this then increases our ability to make causal claims about the relationship between democracy and health inequalities between these two groups. Now, the second aspect of the endogeneity problem is the omitted variable bias. And this is the more intuitive aspect of the endogeneity concern that people or people tend to be more familiar with this, this issue. So basically, we could have a variable that's influencing health inequalities. But if this variable right here is unmeasurable, or if it's unobservable, or we simply don't account for it in our model, then our results just wouldn't be accurate. So let's take a study that compares infant mortality in low-income households to infant mortality in high-income households as an example. So say we want to look at the impact of democracy on inequality, and we look at how democracy has affected infant mortality in poor households. We compare this to how democracy has affected infant mortality in rich households. Now, the challenge here is that other factors could affect a household's income level. And this could explain why some households are poor while other households are rich. So political connections, for example, or intergenerational wealth. We could imagine how these socioeconomic variables could explain why some are poor while others are rich, and subsequently why we see differences in rates in infant mortality. So if we don't account for this variable in our model, we don't control for these potential socioeconomic factors, then our results would be inaccurate. Now, if you compare this to the quasi-natural experiment that we introduced in this paper, if we're looking at democracy's impact on differences in health outcomes between twins and singletons, it's not likely that socioeconomic factors like political connections or intergenerational wealth are really going to play a role in explaining why some are born as twins and others are born as singletons. And these socioeconomic factors are unlikely to have an impact on differences in mortality rates. So the advantage of this approach is that there's a lower chance that there's just some socioeconomic variable hanging out in the background that's impacting our dependent variable. And so this then increases our ability to make claims around democracy's causal impact on health inequalities. Now, there's one additional advantage to our methodological approach that I want to highlight, and that is that this approach is able to capture intra-household dynamics. So let's kind of continue with this example of a study that looks at democracy's impact on infants born in low-income households, compares them to infants born in high-income households. Now, this approach implicitly assumes that infants in the same household are receiving similar treatment. But we know that within a household, infants can receive very different treatment. So firstborn child might receive greater attention than a second-born child, or in some cultural contexts, a male infant could receive preferential treatment when compared to a female infant. So if we're using aggregated household data, what we're missing are these intra-household dynamics. Now, what our study is doing differently is we're using individual level data. So we're not comparing groups by household, we're actually comparing individuals by looking at twins and singletons. And what this means is that we don't have to make assumptions based on household characteristics. Now, we could study this question of whether democracy reduces health inequalities in any region in the world, because dual track capture actually exists in countries everywhere. But we picked Africa for our study for 4 different reasons. So the first reason is that many African countries underwent a democratic transition in the recent period. So in our data set in 1960, there was no country that was classified as a democracy. But by 2016, we see 41% of countries classified as democracies. So we have countries where we can study health inequalities under both democratic and authoritarian regimes. The second reason is because that we chose to study the African context is that in African countries, democratization didn't affect the proportion of twin and singleton births. So this suggests that democracy didn't affect the distribution of twins and singletons. The third reason is because Africa has the highest rate of naturally occurring twin births in the world. And this means that we can build a larger data set to compare twins and singletons. And at the same time, the rates of twinning have also remained relatively stable over time. And what this means is that it's unlikely that fertility interventions like IVF or IUI have played a role in the proportion of twins we see born relative to singletons. Okay, so what I'm going to do now is I'll tell you a little bit about the data that we used in our paper. Now, our independent variable, democracy, was measured using data from the Varieties of Democracy project, or the VDEM project. And we use the Electoral Democracy Index, which captures the two tracks of democracy that we're interested in. Electoral competition is measured by clean elections, elected officials, and suffrage. And civil liberties are measured by the freedom of association and the freedom of expression. And the index takes these component parts, and then it creates a score for each country. And the score ranges from 0 to 1. Now, for our dependent variable, we measure health inequality by looking at the gap between twins and singletons in terms of infant mortality. And to develop this measure of inequality, we used DHS data, data from demographic and health surveys. And what we did was combine birth recode files, which have information on the year of birth of a child, whether they're still alive, and their twin singleton status. And we then matched these data with the VDEM data on democratic transitions and constructed a data set with more than 3.8 million children born to around 980,000 mothers in 39 African countries between 1960 and 2016. Now, to estimate democracy's causal impact, we used a difference in differences strategy that compares infant mortality in twins to infant mortality in singletons under different political regimes. And our empirical strategy is summarized in this linear probability model that you see here. But I know that my time is limited, so I'm not actually going to go into a lot of detail on this. Instead, what I'm going to do is I'm going to talk you through our results, where we measure democracy both as a dichotomous variable. So we look at the impact of democracy before and after regime change. And I'm also going to talk about our results where we measure democracy as a continuous variable. And this is the impact of democracy over the course of democratization. So let me talk a little bit about the results. So what you see here are the main results in panel A at the top and panel B at the bottom. So panel A is the dichotomous measure of democracy, and this means that the data has been coded to compare democracies to non-democracies. And what I'm going to do is I'm just going to highlight some of the main results. And what you'll see is negative and statistically significant coefficients on the interaction term between twin status and democracy. What this means is that the mortality of twins relative to singletons in this first year of life actually decreases following a transition to democracy. And so what we do is we develop different models with varying controls, which you can see at the bottom of the screen. But regardless of the model that we use, the gap in mortality rates declines following democratization. So what this is telling us is that democracy has reduced these health inequalities. Now we see panel B at the bottom of the chart, and this is the continuous measure where we measure incremental changes in democracy. And again, I'm just going to highlight the main results in red, and the results tell the same story as in panel A. You'll see negative and statistically significant coefficients on the interaction term between twin status and democracy. And again, what this suggests is that democracy reduced inequality in health outcomes between twins and singletons. Now, we also do robustness checks. I'm not going to talk about these here, but I can talk about them later if anyone is interested. But our robustness checks look at other cutoff points for democracy, alternative measures of democracy, including data from Polity and Freedom House. We look at pre-trends and other controls, including domestic wealth. And version of the story is that we find the same results again and again, that democracy is in fact keeping its promises in a certain way and reducing inequality between these two groups. But what we don't know, based on these results, is what role democracy's different tracks have played in these outcomes. So earlier I had introduced the concept of dual track capture. So there's this question of whether electoral competition is producing these results, or if it's captured, or if civil liberties are generating these results, or if civil liberties have been captured. So as part of the second part of our analysis, what we do is we unbundle democracy. We look at whether electoral competition and civil liberties are reducing inequality, or whether maybe these two tracks have been captured. And what we see is electoral competition, which you see here on your left, and civil liberties, which you see here on your right. They're both working to reduce inequality in the results that are statistically significant. So it does look like electoral competition may be more susceptible to capture than civil liberties, as the coefficient for civil liberties appears to be larger, and the suffrage variable is positive. So this suggests that civil liberties may actually play a bigger role in reducing inequality. But the key takeaway here is that the two channels or the two tracks by which democracy works, they don't have a uniform impact on health inequality. And this is really important because a lot of the quantitative studies that look at democracy and population health have conceptualized democracy as electoral competition alone. And they don't often look into the impact of civil liberties. So what we're doing in this paper, what we're doing in this analysis right here is we're responding to more recent calls to also investigate the role of civil liberties. And what we're showing is that we can't assume that electoral competition can just be a stand-in for civil liberties as well. Now, our findings so far suggest that democracy reduces health inequality, but what it would also be helpful to understand is the mechanisms by which democracy achieves this. And the literature tells us that higher levels of democracy are actually positively correlated with the provision of basic goods and services. And when we look at the data, we see this is true. We see that, or maybe it's a little bit too small to see, but what these different tables show is that higher levels of democracy, which you see here, are positively associated with the expanded provision of interventions like immunization, prenatal care, skilled birth attendance, and water and sanitation. And so the idea is that democracy facilitates the expansion of basic goods and services. And these basic goods and services are expected then to reduce inequality. But what we don't know is if democracy diverts these goods and services towards resource-constrained groups. Another way of thinking of this is what we want to know is if democracy facilitated redistribution by providing resource-constrained groups with more access to basic goods and services, not just more basic goods and services, but if it actually redistributed basic goods and services so that disadvantaged groups were benefiting more. So what we did was we looked at the distribution of goods and services between twins and singletons, and we're trying to see whether one group accesses public goods and services more than the other. And here what you'll see is basic goods and services broken down by intervention. So immunization, prenatal care, skilled birth attendance, and water and sanitation. So the same interventions that you saw on the previous slide. And what we find is that twins and singletons are actually benefiting from basic goods and services at about the same rate. And you can see this because the coefficients are close to zero. So what this is suggesting is that democracy is not actually redistributing resources to disadvantaged groups, because we don't see twins making more use of these interventions. And yet, when we actually looked at the effect of basic goods and services on the gap in twin and singleton mortality broken down by the different interventions, what we see is that each of these interventions did in fact reduce health inequalities. So we see this based on the negative and statistically significant interaction term. And this indicates that the delivery of basic goods and services reduced the gap in mortality between twins and singletons. So if I were to try to kind of put all of this together, what this is suggesting is that democracy is reducing inequalities, health inequalities in Africa, but not by redistributing resources. It's doing this simply by increasing the broader provision of basic goods and services. And because resource-constrained groups are starting from such a disadvantaged point, they're seeing greater benefits. And this is in turn reducing levels of inequality. So while democracy seems to have kept some of its promises and reduced health inequalities, our findings suggest that, it's not working perfectly in the African context, and it's not redistributing resources. So let me just end by summarizing some of the key points of this study, and then talking a little bit about the contributions of the research. So we started by asking, does democracy reduce health inequalities? And in theory, the introduction of electoral competition and civil liberties is supposed to shift political power to disadvantaged groups and reduce inequality. But in practice, what we know is that dual track capture exists. So electoral competition can be captured and civil liberties can be captured. So what we wanted to know then was whether democracy actually reduced health inequalities if we looked at a large number of countries over a long period of time. But the challenge that we encountered in investigating this question is the endogeneity problem. So what we did was we introduced a quasi-natural experiment using twins and singletons as proxies for resource-constrained and resource-rich groups. And then we looked at democracy's impact on the relative mortality between these two groups. And what we found is that democracy reduced health inequality. And in fact, both elections and civil liberties seem to be playing a role. And democracy achieved this outcome by improving the provision of basic goods and services, because resource-constrained groups were starting from a disadvantaged point. Their ability to access public goods and services had a greater impact on their health outcomes, and this in turn reduced inequality. Now, this study makes a few different contributions to the academic literature that I'm going to talk briefly about. But the first contribution is that this is the first study in the welfare state literature that uses a sibling study to rule out the possibility of reverse causation. And it's the first study to my knowledge. So our first contribution is this methodological innovation. And we carry this out by building on studies that have used individual data. The second contribution that we're making is to introduce this concept of dual track capture. And this is a political phenomenon that has been approached by the welfare state scholarship in a very piecemeal way. So what we're doing in this paper is we're bridging disparate literatures on clientelism, corruption, and also political ideas and attitudes to try to theorize the ways in which democracy can be subverted. And the third contribution is to add to a broader literature on distributive politics and who benefits under democratic rule. But there are also some empirical implications of our findings that I just want to quickly point out. And you may have seen this just the week before. There was a piece that came out that read, UN chief raises alarm over the backsliding of democracy worldwide. Now we can talk about democratic backsliding, democratic careening, whatever we want to call it. And there are many reasons to be concerned about this. But what this paper is doing is it's adding to the conversation by highlighting some of the health concerns that could be associated with democratic backsliding. So that brings me to the end of the presentation. Thanks for being here. Thanks for listening. And I also just want to acknowledge some folks who have read earlier drafts of the paper and shared very helpful feedback. So if anyone has any questions or thoughts they want to share, I'd love to hear from you.